Protecting teeth at an old age is essential for maintaining oral health and overall well-being. Here are some tips to help. 1. Brush and floss regularly. Brushing your teeth at least twice a day and flossing once a day helps remove plaque and food particles that can lead to tooth decay and gum disease. Use a soft-bristled toothbrush and fluoride toothpaste. 2. Visit your dentist regularly. Regular dental checkups and cleanings are crucial for detecting and addressing any oral health issues early on. Your dentist can also provide personalized advice and treatments to keep your teeth and gums healthy. 3. Avoid tobacco products. Smoking and using other tobacco products increase the risk of gum disease, tooth loss, and oral cancer. Quitting smoking can significantly improve your oral health and overall health. 4. Limit sugary and acidic foods. Consuming too many sugary and acidic foods and drinks can contribute to tooth decay and enamel erosion. Limit your intake of sugary snacks, sodas, and acidic fruits, and drink plenty of water instead. 5. Protect against tooth wear. Tooth wear, such as erosion and abrasion, can occur over time due to factors like grinding your teeth, using a hard toothbrush, or consuming acidic foods. Use a mouthguard at night if you grind your teeth, and choose a soft-bristled toothbrush and gentle brushing technique. 6. Stay hydrated. Drinking plenty of water helps stimulate saliva production, which helps rinse away food particles and neutralize acids in the mouth. Dry mouth, which can be a common issue as you age, increases the risk of tooth decay and gum disease. 7. Consider fluoride treatments. Fluoride treatments, such as fluoride mouth rinses or gels, can help strengthen tooth enamel and prevent tooth decay. Your dentist can recommend appropriate fluoride treatments based on your oral health needs. 8. Practice good denture care. If you wear dentures, it's essential to clean them regularly and properly to prevent plaque buildup, irritation, and infection. Remove and clean your dentures daily, and visit your dentist for adjustments or repairs as needed. 9. Maintain a balanced diet. Eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains provides essential nutrients for healthy teeth and gums. Calcium, vitamin D, vitamin C, and phosphorus are particularly important for maintaining oral health. 10. Stay informed. Stay informed about oral health issues and advancements in dental care by regularly reading reputable sources, consulting with your dentist, and attending dental checkups and seminars. By following these tips and prioritizing your oral health, you can protect your teeth and maintain a healthy smile well into old age. One of the biggest myths about aging and oral health is the belief that losing teeth is a normal part of getting older. This is absolutely not true. Your teeth should last you a lifetime. The status of your dentition and mouth are paramount to your overall health and will contribute to your overall longevity. Translation: if you look after your teeth, you're looking after the rest of your body and setting yourself up for longer-lasting and far better quality health. Long-term mismanagement of your mouth can result in chronic gum inflammation, commonly known as gingivitis, bleeding gums, that will eventually lead to the deterioration of the structures that are the foundations of your mouth and can lead to tooth loss in old age. Some medical conditions are linked to and can affect the oral health of older patients. Some examples include cancer, diabetes, and cardiovascular disease. Poor oral health can make some conditions worse, so it is important to let your dentist know if you have any illnesses, so he or she can take certain factors into account when treating you. There are strong links between people who have gum disease and heart disease, with the likelihood of heart attack a significant factor in severe gum disease. Many patients feel that their teeth are cleanest when they use stiff bristles and lots of pressure while they brush to scrub their teeth clean. Your teeth might feel clean, but brushing this way isn't good for you. As we age, our gums begin to recede naturally, and brushing hard can hasten this process. Going easy on the brushing doesn't mean not brushing well. It means switching to a soft-bristled brush and using gentle pressure. Brush for 2 minutes, twice a day, making sure to brush the front, back, and chewing surfaces of all of your teeth. Even better, treat yourself to an electric toothbrush, which does a fantastic job of keeping your teeth clean and even has a timer to help you make sure you get that full 2 minutes in. Staying hydrated is good for your overall health, and it's also good for your teeth. When your mouth is dry, it can wreak havoc on your teeth and gums. Saliva works to dilute and wash away acid from food, drinks, and bacteria throughout the day. Without sufficient saliva, this acid is more concentrated, leaving teeth prone to decay. Saliva also contains minerals and immune cells that protect our teeth. As we age, many of the medications we take to stay healthy can cause dry mouth. The easiest way to prevent dry mouth is to drink lots of water throughout the day, not juice, coffee, tea, or soda. Carry a bottle of water with you when you're out and about. Don't suck on hard candies to keep your mouth from feeling dry. Sugar-free lozenges or gum are a better choice when water is not available. An alcohol-free mouth rinse designed specifically for dry mouth can help too.